Good afternoon, everyone. Welcome to the Kern County Medical Emergency Care Advisory Board meeting of May 14th. At this time, we will call the roll.
John Surface.
Here.
Larry McCurtain. Tyler Wetzel.
Here.
Chief Albertson. Orchel Crier.
Here.
Chairman Flores.
Here.
Dr. Lyon.
Here.
We have a quorum.
Thank you. At this time, that brings us to our flag salute. Mr. McCurtain, would you please join me in the flag salute? Thank you.
Salute. Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. That brings us to the consent agenda. All items listed with the CA are considered by program staff to be routine and non-controversial. The CA represents the consent agenda for the board members of MCAB. Consent items will be considered first and may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAB may remove any item from the consent agenda, and it will be considered in listed sequence with an opportunity for any member of the public to address MCAB concerning the item before action is taken. Call for a motion on this time on consent.
Motion.
Thank you.
Second.
We have a motion and second. All in favor?
Aye. Aye.
Opposed? None. Okay, thank you. That brings us to public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on the agenda but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask questions for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please state and spell your name before making your presentation. Are there any public presentations this afternoon? Now's the time. Okay, seeing none, we will move on to board member announcements or reports. Okay, seeing none, that brings us to our emergency medical services program requests. And at this time, I'll refer it back to the manager's report. Mr. Ferris.
Thank you, Mr. Chairman. Good afternoon, Mr. Chairman, members of the board. Since this is the annual review of 2025, that's what my manager's report reflects today. Throughout 2025, Kern County EMS continued strengthening the county-wide emergency medical services system through innovation, collaboration, and continued focus on patient-centered care. Operational improvements, expanded educational opportunities, and enhanced public outreach efforts positioned the EMS system to better serve both urban and rural communities across Kern County. The Operations Division implemented several significant system-wide improvements during the year, including updates to EMS personnel accreditation policies, expansion of field protocol usage, and continued public education initiatives focused on life-saving interventions and emergency preparedness. These efforts reflected a unified commitment to improving service delivery, enhancing patient outcomes, and ensuring the EMS system remains adaptive to the evolving needs of Kern County residents. In 2025, Kern County experienced continued growth in emergency medical service demand. Total 911 call volume was 140,816, which represents an increase of 1.63% from 2024. The increase in call volume further emphasized the need for system adaptability, operational coordination, and efficient patient movement throughout the healthcare system. In addition to rising call volumes, ambulance patient offload times continued to increase, creating ongoing operational challenges for EMS providers and healthcare facilities alike. EMS leadership continued collaborating with regional hospital partners to identify strategies aimed at improving patient throughput and reducing delays in care transitions. Hospital destination patterns remain generally consistent throughout 2025. Adventist Health Bakersfield and Bakersfield Memorial Hospitals continued receiving the highest percentages of ambulance traffic. Behavioral health and psychiatric crisis patients remained concentrated to Kern Medical, the psychiatric receiving center. Approximately 53.74% of behavioral health related transports were directed to Kern Medical Psychiatric Services. These trends continue to drive system planning, hospital coordination, and future EMS deployment considerations. Quality improvement remained a cornerstone of EMS system oversight and accountability throughout 2025. Several important changes were implemented to strengthen future quality improvement and system collaborative meetings, ensuring a more data-driven and standardized review process across agencies and providers. During 2025, 116 EMD code changes were completed. 89 calls were downgraded and 27 calls were upgraded. These reviews helped improve dispatch accuracy, optimize resource allocation, and ensure patients receive the most appropriate response. A total of 668 electronic patient care records were randomly selected for audit during the year. The results were 76% received a grade of A, 14% B, and 10% C. These findings demonstrate strong overall documentation quality and continued commitment to clinical excellence among EMS personnel, throughout the county. During 2025, the following personnel were reaccredited or newly accredited to the Kern County EMS system: 59 MICNs, 39 emergency medical dispatchers, 172 paramedics, 8 paramedic preceptors, and 1,180 EMTs. The continued growth and maintenance of a highly trained workforce remains critical to ensuring high-quality emergency medical care throughout Kern County. Community engagement remained a central focus throughout the year. EMS personnel continued building strong relationships with residents throughout public education, emergency preparedness campaigns, and direct community involvement. 500 civilians were trained in hands-only CPR, and 100 individuals received Stop the Bleed training. These programs equipped community members with essential life-saving skills and strengthened community resilience during emergencies. EMS continued supporting several public safety outreach initiatives, including Water Watchers awareness, heat safety education, digital public safety messaging, and community events and outreach campaigns. These initiatives emphasized prevention, preparedness, and public empowerment while helping residents better understand how to respond during an emergency. To improve early intervention during cardiac emergencies and other critical incidents, more than 164 new first responders were granted verified responder status through PulsePoint. This initiative expanded the availability of qualified off-duty responders capable of providing immediate assistance to community members in crisis before ambulance arrival. As Kern County EMS enters 2026, the organization remains focused on continuous improvement, innovation, and collaboration. Key priorities for the coming year include expanding EMS technology and communication capabilities, further enhancing training and leadership development programs, strengthening regional and community partnerships, and continuing quality improvement initiatives, and supporting workforce recruitment, retention, and wellness, and finally, advancing community education and preparedness efforts. Kern County EMS remains committed to delivering exceptional emergency medical care while continuing to adapt to the evolving needs of the community. Through the dedication of EMS professionals, partner agencies, healthcare providers, and community stakeholders, the county is well-positioned to continue building a stronger, more responsive EMS system for the future. Now, with that said, unfortunately, it is my unfortunate task today to notify you that as of Tuesday, Tele 911 is no longer in business. So we have lost that tool from our toolkit in the field. We are currently conducting meetings and discussions on how we are going to move forward from this point. That concludes my report. I'm available to answer any questions.
Thank you. Thank you for that comprehensive report, and sorry to hear about telehealth, and we will have to make do, but I'm happy that you're making progress on so many fronts, serving our community, keeping our system sound, and protecting emergency services. Any comments or discussions from board members? Okay, seeing none, I'll entertain a motion. Okay, we have a motion.
Second.
And a second. All in favor? Aye. Opposed? Okay, motion carries. Brings us to item 4, APOT Task Force report.
Thank you, Mr. Chairman. I'll be handing this over to Bryn Kerrigan to give her report.
Thank you, Ms. Kerrigan.
Good afternoon, Mr. Chairman and members of MCAB. My name is Bryn Kerrigan, Director of Kern County Public Health. Ambulance patient offload times, or APOT, delays continue to be a growing concern despite our continued efforts. As reflected in the annual APOT report included in your MCAB packet, the total number of ambulance patient offload delays exceeding 30 minutes in 2025 was 28,294 hours. To date, in 2026, offload delays exceeding 30 minutes have already totaled 11,394 hours. If this trend continues through the remainder of the year, Kern County is on pace to exceed last year's total, with projected delays estimated to reach approximately 31,594 hours in 2026. Each month, Kern County Public Health staff distribute APOT data to APOT task force members as well as all hospital CEOs to ensure continued awareness and visibility regarding system performance and trends. We continue to meet regularly with APOT task force. In January of this year, Sandro Brianos, Emergency Department Director for Antelope Valley Medical Center, joined the task force to present on their operational strategies that they implemented at their facility that have resulted in significant improvements in APOT times. Task force members expressed interest in learning more about these efforts, including seeing how their processes worked, which led to a tour being arranged at Antelope Valley Medical Center on April 22nd. Unfortunately, representation at the tour was limited to only Liberty Ambulance and Adventist Health. Following the limited participation, I reached out directly to the larger hospital CEOs to express my concern regarding the lack of engagement and the apparent lack of prioritization surrounding this issue. I asked whether there were additional ways Kern County Public Health could support participation and collaboration in improvement efforts. To date, I have not received a response to that outreach. At this point, Kern County Public Health remains dedicated with substantial staff time and resources towards APOT-related efforts. However, it is not producing meaningful system-wide improvement at this time. On a more positive note, Adventist Health recently hired a dedicated pre-hospital liaison nurse whose primary focus is ambulance patient offload coordination. She has already initiated outreach to ambulance providers and to Kern County Public Health to establish bi-weekly APOT collaboration meetings aimed at improving patient throughput, identifying operational barriers, reducing offload times, and enhancing ambulance availability throughout the community. Our first meeting is scheduled for May 28th, and we remain hopeful and encouraged by the potential of this partnership. Mr. Chairman and members of MCAP, this concludes my report, and I'm happy to answer any questions you may have.
Thank you. Any questions or comments for Ms. Kerrigan? Okay. Seeing none, I'll entertain a motion. Okay, you have a motion. I'll second that. All in favor? Aye. Opposed? Okay, motion carries. And actually, that brings us to adjournment. So the deadline for submitting requests for the next MCAB meeting is Thursday, July 30th, 2026 at 5 p.m. to the EMS program manager. So at this time, we'll adjourn to Thursday, August 13th, 2026. Thank you.